War, the place of death, injury upon soldiers, devastation of land, in need for resources to heal our men of wounds, security among our country. Rewinding back to the Civil War, there were several important aspects that shaped the outcome for the mass conflict. A huge part of our war was the ability to receive medical care for our wounded soldiers. This is Civil War Battle Medicine. Throughout the life on the battlefield, there were a few designated soldiers whose responsibilities were to help the wounded when injured in war. Generally, Civil War doctors would have undergone 2 years of medical school, learning the basics of surgical techniques in order to cure the wounded soldiers. Civil War surgery was performed by doctors who had previously worked in the larger field hospitals locations with operating rooms and specific tools in order to properly help the injured patients. Surgeons learned to amputate body parts in order to keep the patient alive, and learned to perform a wide variety of procedures as they were actively engaged in war conflicts. Amputations performed within 24 to 48 hours after injury. This was considered a primary amputation. A secondary amputation was one performed more than 3 days after injury occurred. After recording results of which amputation saved more lives, they soon realized the primary amputation technique was more effective. A huge downfall when recovering wounds was a lack of cleansing among surgeons. Civil War surgeons often operated with dirty hands from patient to patient. Also, not cleaning surgical tools in between surgeries was a huge factor when bringing disease to soldiers in battle. Due to this complication, the establishment of medical standards said only the best were allowed to operate. By 1863, there were just 3 experienced higher-level surgeons operating at field hospitals during the Civil War.
Moving forward to the key aspects that indeed made it easier for Civil War battlefield doctors to cure their patients. Many innovations implemented during the war that helped to bring the practice of medicine into the modern era include the advancements in surgical procedures, the management of traumatic wounds, a specialization in plastic surgery, and nerve injuries. Looking ahead, there were 5 different parts to surgical techniques that entering the Civil War included. The first one is amputation, where it's a process of removing limbs from a body to stop the spread of disease to larger parts of the body. The second one is anesthesia inhaler, which is used to numb the patient to relieve large amounts of pain in the body. The third one is the act of closing chest wounds, was a technique by closing the wound with sutures and following that with linen bandages and a few drops of substance named collagen that's supposed to help seize the skin together, help close the skin faster, and these medics were able to seal the chest wounds and prevent lung collapse. The fourth one was facial reconstruction, and it benefited many wounded soldiers by using plastic surgery on wounded men. The fifth was the ambulance to ER systems, which allowed doctors to shuttle wounded soldiers back and forth from the battlefield to the nearby hospitals to receive the help they needed.
During the Civil War era, health was looked at differently than today. Due to the supply and procedure limitations, there were aspects of human health that drew a line when it came to curing and providing support to those who have been wounded in battle. The accessibility that was offered and the repairing of limbs and body parts were at terrible risk because the amount of trained surgeons and doctors able to assist soldiers was short. Most Civil War surgeons had never treated war-wounded soldiers, and many had never even performed surgery. Yet the Civil War doctors, as understaffed, underqualified, and undersupplied as they were, did the best they could with the amount of knowledge and supplies they had. Treatments that underwent the life of Civil War soldiers consisted of specific medications that made significant gains during the course of the war. However, it was the tragedy of the era that medical knowledge of the 1860s had not yet encompassed the use of sterile dressings, anesthetic surgery, and the recognition of importance of sanitation and hygiene, resulting in the deaths of thousands of soldiers due to the diseases such as thyroid disease and the malaria epidemic.
Throughout the 1800s, the Civil War disease played a huge role in the death among soldiers due to the brutal wet and cold conditions surrounding the battlefield. For every soldier who died in battle, 2 died of diseases such as diarrhea and dysentery. These diseases took more soldiers' lives than gun and bomb wounds did. The Civil War soldier also faced outbreaks of measles, smallpox, malaria, pneumonia, and camp itch. Men on the battlefield were exposed to malaria when camping in damp areas. Overlooking the disease and medical solution in a time period of mid-1800s in the Civil War, there were multiple parts that shaped how soldiers died and got cured without the battlefield protecting doctors providing assistance to those soldiers. Our men would suffer from severe death.